Brigadier General Deidre Tahan. Welcome to our 8th episode of BAMC Med Talk. Today's episode will focus on topics important to men's health. Although men face certain health problems that are specific to their body, such as prostate cancer, most issues faced by men and women are the same. Yet studies show that men are more reluctant to go to the doctor than women. This may be due to discomfort discussing certain issues, such as difficulty urinating, or a hesitancy to change unhealthy lifestyle habits. Fortunately, we have several world-class experts with us today to improve awareness of preventable health problems and to share the latest men's health guidelines and recommendations. Welcome to Cardiology. Can you tell me a little bit about what you do for the San Antonio market?
Yes, ma'am. I have the pleasure of having one of the greatest jobs. I'm a cardiologist. But more than that, I get to work with our active duty service members, their families, retirees, and help them understand the benefits of cardiovascular risk prevention. We do that through a multitude of ways, really focusing on changing habits to improve their health.
That is so wonderful. What screening tests should men do and at what age for their cardiac health?
Excellent question. But a lot of times, ma'am, symptoms are the driver. But if we're purely talking about screening, many things as simple as a blood test, testing your cholesterol, a test looking for diabetes, a hemoglobin A1C, and a host of other blood tests to identify what we call risk factors. We understand that risk factors occur in two ways. You can have modifiable or non-modifiable. Non-modifiable are those that really you can't do anything about. You can't do anything about how old you are, whether you're a male or not, and what your family history is. But you can change your lifestyle, whether that be exercise, your diet, sedentary behaviors, or other things that we know increase your cardiovascular risk.
To help the men in our area, you have the 3 Ps of cardiology. Can you tell me a little bit more about the 3 Ps for cardiology?
Yes, ma'am. Now, as I told you, these aren't only for men, these are for any patients, but men specifically need to understand that when we focus on their health in cardiology, we focus on the 3 Ps. And those are, first, we want our strategies to be preventive. As much as I enjoy seeing patients, I would much rather see you walking around healthy and happy than seeing me in a cath lab. Secondly, we want them to be practical, right? We want men to understand that many of the exercises, workouts, and supplements that they do might not necessarily fit where they're going, but we want to provide strategies to help them reach their goals and achieve their best version of themselves. Finally, for our tip of the spear guys, special forces, pilots, and the like, we want our approach to be performance-based. Hence our role of the Human Performance Center and other things that we offer in cardiology across the spectrum of patients that we see.
We have a world-class cardiology clinic here at Brooke Army Medical Center and at Wilford Hall. Thank you so much for what you do. We really appreciate it.
Yes, ma'am. Thank you for the opportunity.
Welcome to BAMC's GI Clinic. Dr. Patel, can you tell me a little bit about what you guys do here?
Yes, so I'm Colonel Anish Patel. I'm actually the director of the Inflammatory Bowel Disease Center here. So we have a mix of things that we do here, okay? It's for really kind of focusing on men's health. We focus on screening. We do a lot of colonoscopies, upper scopes. We have a really big liver division over here. We are one of the largest GI divisions in the DoD. So we're able to have a lot of services here and kind of take care of all the dependents and beneficiaries here and active duty service members.
For Men's Health Month, what should men know about what type of screenings they should do and how you guys can help them?
I'm a man, all right? We're stubborn, all right? So I think one of the big things is colon cancer screening. I think this is something that's a preventable cancer. Colon cancer is one of the leading causes of death in men. It's actually preventable. And one of the big things you can do is get a screening colonoscopy. It's a very quick little screen we can do in the endoscopy suite to make sure you don't have cancer. And starting at the age of 45 and above, we do colon cancer screenings on everybody. And typically recommend is talk to your primary care doctor. Talk to your primary care doctor first, and they can bring it up, and then we see them afterwards.
Yeah, it's so important for everyone over the age 45 to start screening themselves for colon cancer. The other thing I'd like to ask you about is what other services or tips you have for men and their overall health?
Yeah, so I think it's a big one. I think one of the big things outside of colon cancer, I think liver disease is a big one that we worry about. Okay, so fatty liver is one kind of growing epidemic that we have. So, kind of piggybacking cardiology, nutrition is a big one for us. Okay, so, eating healthy, exercising, I think those are two big things we can always push on everybody. I think it hits men's health too. I think those are two big things we can kind of focus on when it comes to GI health also.
Wonderful. Anything else you would like the men that come to BAMC to know about their overall health?
Well, I think the big thing is we're here, all right? And don't be shy. All right? I think that's the one big thing is the worst screening and the worst thing you can do is not talk and not do something. I think that's a big thing. So we're always here to help.
Well, thank you for all you do to help all the men and women across the San Antonio
Thanks,
market.
man. Appreciate it.
Welcome to BAMC Urology Clinic. Can you tell me a little bit about what you do here in urology?
Sure, we do all the medical and surgical diseases of the genital urinary system.
And what are the 3 things that you think most men need to know about on when they would want to come to see you in urology?
We do mostly urinary symptoms, sexual symptoms, and fertility.
And what type of screening do you think men need to know about for their urology health?
Prostate cancer screening.
And what is that?
So we do blood work and clinical rectal examinations.
In what age should they start doing that screening?
From about 45 all the way to about 75.
You know, you described the 3 things that you guys do here at the urology clinic, but I bet that's hard for a lot of men to come in and talk about. How do you guys make it a little bit easier for them to come in and get care?
Yeah, excellent. So yes, we always encourage if you're having any urinary symptoms, sexual symptoms, don't be shy, come in to see us. We're happy to explain everything in basic terms.
That's wonderful. Thank you for helping them feel at ease in getting the care they need.
Thank you, ma'am.
I would like to thank all of our experts for taking the time to highlight the importance of men's health and talk about the services available here at BAMC and within the military health system. I'm incredibly proud of all of our teammates helping to ensure our health and wellness. Thank you for watching the latest episode of BAMC Med Talk.